In this episode of Influencers, Zus Health CEO, Jonathan Bush.
Getting fired is a really great, after you recover, assuming you do, a great experience. The thing that was most gratifying was watching people do more than they thought they could. I mean, we've been trying to liquefy medical record and health data forever. And it's only now just starting to frack and leak out.
Hello, everyone, and welcome to Influencers. I'm Andy Serwer, and welcome to our guest, Jonathan Bush, CEO of Zus Health. Jonathan, so great to see you again.
Andy, same here. This is exciting.
Back at it, both of us. We'll get to Zus in a minute, but first I want to ask you a little bit about the healthcare business in general. You wrote last year, we would come to view this era as, quote, an inflection point in modern healthcare. What did you mean by that, Jonathan?
Well, we've known that healthcare is largely an information product. Not all, right? We do surgeries, but a lot of it is analyzing data and coming up with conclusions and passing them on. And everywhere else in our lives, information is separable from our body. We have language, we have the internet, but somehow in healthcare, the only way you can get information is to move your whole ass with your brain, into the doctor's office or the hospital or and then with COVID, of course, we couldn't do that. We were forced to separate the information from the body, and we had an explosion. We had an enormous reduction in medical costs, despite the huge medical costs associated with COVID. We had an explosion in the use of telemedicine, real satisfaction with it. And McKinsey proudly did a study before COVID saying that over the next multiple decades, 18% of medicine could be virtualized. And then 7 seconds after they hit send, 90% of medicine was virtualized. And so that was what I meant by the inflection point. And we've seen all the tools around virtualizing information products, such as you and I sitting here today, you in your bedroom, sorry about being kicked out of the living room. Whereas before I had to bring my derriere down to the big temple of Yahoo Finance with the cameras. We've all gotten very good at compressing and streaming information and care and connection. And that's a hugely valuable thing for medicine.
Right. So how sustainable is this trend? I mean, obviously, we've seen this digital transition take off, but will people start going back to the doctor as the pandemic wanes?
Well, obviously, there's surgeries that we've put off. My hip hurts. I want to get a new one or whatever, and we didn't, and now we're queuing up to do that, which is clogging up. So there's some stuff that, of course, has to go back. But it's absolutely the case that the percentage of stuff that can be done as well or actually better, significantly better at any price, turns out to be much cheaper. But even if it was more expensive, it'd be worth it, has exploded. The idea of messaging a care team or a provider is actually better documentation than even the most granular set of drop-down menus in an electronic medical record, because we've gotten good at machine reading language and looking for patterns and getting all that chatter back and forth over a long period of time, particularly on the 80% of our healthcare that is behaviorally rooted disease, that is mostly cured by behavior. Those words, that chatter, being machine readable as opposed to lost to history between you and your doctor as you sit there naked on the wax paper. And then, she turns around and clicks a bunch of clicks and puts you into categories that may not be perfect. That improvement is permanent, and I expect it to track.
Right. How soon will it be the case that doctor visits are done virtually unless you need a physical exam or operation? And is that really something that's going to happen?
I don't know how deep you go in your interviews, but it'd be fun to get a historian to go back and explain how the annual exam came into being. It was when the procedure codes came into being and the doctors said, wait a minute, what about all these preventative things? And they sort of put together a negotiated settlement of preventative tests that would be covered in this new kind of preventative care health management organization kind of world. The truth is that annual exam is a bit of an artifice from that time and is not the optimal way to do preventative care. The optimal way to do preventative care is to continuously be checking in. And sure, there are screenings. I want to get a pap smear. I want to get it, poop on the card. These things can be separated, should be much better done, separated from the preventative care sort of channel as a screening. And with all of the pharmacies now getting into being points of care, with the explosion of urgent care chains, and with the ability to mail diagnostics to the home, we can do much, much, much better primary and preventative care in a streaming kind of consultation with anything, with a bot, with a coach, with a nurse practitioner, with a doctor, depending on your preferences and conditions, and then doing the screenings as a separate channel. And so I think that the record is clear that this is a superior approach. Whether the various delivery organizations can shapeshift themselves and their economic models to fit that, is actually being played out as we speak.
So won't all this virtual healthcare, or shouldn't it, make the whole proposition more affordable? And shouldn't insurance premiums come down? For sure.
I'm on the board of Firefly Health. They're out there selling a full coverage for 30% less than the prevailing market they started in New England states, but they're licensed in 50 states. And their whole deal is, if we can deliver it to you virtually, we'll give you no copay and no deductible if you let us book the things you need. You can still use the network and pay your regular copay and deductible, but the difference in being able to stream in the right specialist with just the information needed, as opposed to send them off and take a half a day off of work and fill out the forms and do the old way, is really profound. So it is making it through the stack to a price point, to a packaging set that a consumer or an employer can now see and buy. Just starting to. There are other companies that are almost at the place of Firefly. Included Health, which used to be Grand Rounds, is getting close to that. Crossover is getting close to that. A lot of great companies that are stacking the full product that we're used to seeing, but with digital offerings in the stack that change the price point. Right. And I should throw in, it's not less care. The Firefly members are seeing the doctor 41 times a year, and those same members pre-Firefly were seeing them once every 19 months. Because instead of seeing, they can whip a text in during a red light.
Mm. Yeah, you got to be careful about that texting while driving, though. I mean, I know you said red light, but maybe when you get to the office or home. All right, listen, so progressives like AOC and Bernie Sanders have been pushing for a single payer system to make healthcare more affordable for middle and lower income people. What do you think about that?
It's funny because all the way back to Hillary Care, when we were children in the fields of Iowa together, or maybe New York, Upper East Side, the retort to the single payer people was, you need flexibility. You need the market to be able to evolve and germinate, and you need room for product agility. And what you'll do is freeze time and have some Soviet-esque thing that sounded great in a PowerPoint or a keynote, but atrophies into something horrific over time, with coffee lines or black markets for gasoline or pap smears on the black market. What's been sort of the counterpoint to that is, yeah, but it hasn't really changed that much, you guys. Like, we're still doing, the atomic unit of medicine is still the claim. The primary method of delivery is still this office that looks like it fell out of 1979. What's been interesting about the digital health movement is we're seeing now sort of disproportionate evolution. So I hope AOC is paying attention, and maybe she can demand nationalized digital health or whatever. But for sure, right now is a bad time to freeze time. Because after a long, long stagnation, we're seeing a real liquidity. And of course, a real liquidity in data. I mean, we've been trying to liquefy medical record and health data forever. And it's only now just starting to frack and leak out.
Yeah, I'm wondering about that a little. Every time I go to a doctor's office, Jonathan, they give me a clipboard, a piece of paper, and a pen where I'm handwriting the same information I've written a million times.
Yeah.
And I ask them, don't you have this in a digital form somewhere? I mean, this is crazy. Is that HIPAA? Why is that?
Well, as I mentioned earlier, I don't know. I mean, I wish there was enough time and anyone would stay on Yahoo Finance long enough to go through this with me, because I find it fascinating. But suffice it to say that the atomic unit of medicine today is a procedure, is a something that you can put on a medical claim and bill for. The idea of finding something that was in the past that eliminates your need to do that is a negative ROI idea. Now, they're now in the last, I'm sure you've covered it a ton. In the last 5 years, you've seen 4,000 new digital health companies, right? That are unique in their makeup. They make code, they make software and deliver care under the same roof, in the same tax ID number. So the agility and the innovation and the ability to manipulate information is unprecedented in medical history. That crowd also has business models that do not have the claim as their atomic unit. Their memberships, it's $20 a month, it's $12 a month, it's $80 a month, $50. And they make money every time they find an arbitrage. Every time they say the results from this test over here. Oh, he went to the emergency room for this last month. Oh my God, he has missed his pill taking. These guys make money when they capture a data synergy of some kind. And so suddenly you've got tech forward people with business models that make money when data is efficiently manipulated, and you got to change. Your doctor, God bless he or she, does not make more money if they find something in your digital past that they didn't know about.
You're right. I mean, this field is littered with rabbit holes. Okay, we got to, a little bit goes a long way. So let's turn to Zus,
Yep.
Your new company, and so tell us what it is. B2B. It's the father of Athena, which was your old company. A lot to unpack here, Jonathan.
Well, at the time of Athena, my thought was it would be good to get doctors onto this internet thing. Like, the internet's going to be big. They should be on it. They should use it. And how could I make a doctor more money doing something that I wanted, right? And what we found was that if we started by putting those claims, the handling of their back room onto the internet and wicked it out of their lives and gave them more time for clinical care, which, by the way, was where they made their money, they'd come on board and more or less successful in that pursuit. Now, I thought I would have a very easy time then in the background, joining all the data and creating a healthcare internet that other products could be built on. And I did not get there. Athena got close and we had More Disruption Please, which was a marketplace. And we tried to make it fun for folks to leave the wonderful, the Googles and the Netflixes and build ventures in healthcare. But it wasn't a lot. It wasn't a lot. I think maybe $8 billion of total capital into ventures the year I got fired, 2018. And a lot of work architecturally trying to pull that all together behind the scenes at Athena. So when I was given my required vacation for a couple of years, I enjoyed watching the emergence of this class of company that wanted to share data. And I thought, what if I started from zero, and actually built something that was natively shared? What if I built Spotify to the established medicine's iTunes? Poor Steve Jobs, he loved his collection so much. He couldn't imagine people wouldn't want to own their own copies of, the Beatles' White Album, right? And finally, he was right for a long time until just every single song ever sung by every artist in every nightclub is sitting there on Spotify. And you say, all right, I'll just turn my device into a lens. I'll point my lens at that giant database of songs, and I'll let go of my ownership of the White Album. It'll be on my CD wall somewhere in the basement in a shoebox. the same inflection point, it seems, could happen in medicine, where starting with these young gun companies that are these digital health companies who are fundamentally kaleidoscopic in nature, that, RIA Health only does early stage, alcohol abuse disorder, and Groups only does opioids, and Livongo only does pre-diabetes. These guys don't have any designs on building a vertical monopoly across all of care. They want to be narrow. So they benefit from being able to share and see what's going on with patients outside of their narrow focus, right? This group they either got to build the whole Athena net themselves, which is a long, long putt, having done it for 22 years, or somebody's got to at least be their water boy, at least give them some. So what Zus decided to say is, let's build the common stuff, the undifferent. You don't need to build your own patient registration, right? You don't need to build the ability to write a prescription from scratch. You don't need to build the ability to do a care plan, or message a care team. Let's build an API library for these new companies to build their marvelous, unique technologies on. But let's provide a Spotify. Let's provide a common data model, a common data store, and a set of APIs, set of workflow, speeder-upper developer kits, so that you can get to market quickly, easily, and build stuff. Spend all your engineering money and your venture capital money building things that are unique to you, rather than grinding through the commodity stuff. So that's what Zus is. Zus is kind of a backstage, rent a roadie for your show if you want to build a song, build a concert in digital health.
Right. So how old is it, Jonathan? How big is it? How do you measure the growth?
Huge, very reliable. All the people viewing should feel very safe, risking their venture money on it. It's I think we took money from our venture partners in June or May. And there were about 3 or 4 of us who were sort of toying with it for another 6 months before that. So we're just getting started. We've just got, something we call Arrival. It's exactly what you said. Actually, so funny you mentioned, the clipboard. So all of these companies now went from the clipboard, a paper clipboard, to what they call a form stack, basically a mobile device now asking you 92 questions to answer with your thumbs in order to get your digital health, right? So that data exists on people. The first thing we're offering is, hey, let us do your registration and new member onboarding through this API, so that Andy doesn't have to fill out all those questions again. We'll get down to the 3 questions that no one's ever asked him. We'll ask him those, but the rest will be answered. So that's the first thing Zus does. Then there's build a care team, and then we're going to do referrals after that. But right now, it's just that. Get started with a new member as a digital health company.
Right. So in theory, a doctor's office or a hospital or a big healthcare provider could use you guys as the back end to access my patient information. And again, HIPAA compliant. I mean, I'm always hearing that's the problem.
Yeah. No, there's HIPAA, and there's a new law called the Cures Act, which actually liberalizes who can authorize data. So all of the crap that you have to comply with is inbuilt to Zus, so you don't have to worry about it. And we'll take it very seriously, of course, for you. Doctors' offices and hospitals are unlikely early users of Zus because they are unlikely to be writing their own software. So this is not a competitor to Athena Health. Athena Health sells to doctors and hospitals. We're really interested in people who want to write their own EMR, write their own CRM for their customers. So we appeal, we hopefully appeal, we try to appeal, we flirt with the developer community, the product manager community in venture-backed digital health.
Right, got it. Okay, that's a little different. I'm glad you clarified that, Jonathan. So let me ask you kind of a big thing question.
Okay.
Is there too much or not enough regulation in healthcare?
Whatever there is, we've come by it honestly. As you travel the world and you look around and you get tempted to get cynical. There's obviously regulation sclerosis, regulations that came into being for a very good reason in a very pregnant moment where we were offended by some terrible thing that happened, and our elected officials gathered and said, we got to prevent that from happening ever again. Lots of guys frankly, in our home of New York, got really good at ripping off Medicare by sending in fake mammography claims from Brooklyn, and so all kinds of penalties and proof of this and ways of using forms were built in to stop that perfectly legitimate concern. So in general, whenever we get into a place which we care about, we end up regulating it. And when we do, we end up with sclerosis. So obviously healthcare we care deeply about, and we've got lots of sclerosis. I've decided to stop being angry or frustrated and appreciate how we got to it, which is we got to it honestly, and then build machines that'll whip through it and make it less painful.
Let me jump back to Zus. I'm sorry to jump around, Jonathan, but you're pretty good at handling on that kind of thing, right?
It's the only way I can operate.
I know. That's what I meant. So what about Zus, top competitors? What differentiates you guys from others? What's the TAM?
Yeah.
The
TAM is extremely small today, because while digital health gets hopefully a lot of press, I read about it a lot, but maybe I read the wrong rags. It's got a lot of potential. It's $40 billion of venture capital just in the last year and a half into this space. Granted, it's Jerome Powell dollars, which are, more and more meaningless, but still a lot of capital into the space. It's still a relatively small percentage of all care, right? So our TAM is small because we're targeting these 4,000 companies that are building new digital health solutions. If it takes off the way I think it will, if the wave stays on the beach and it becomes a sustainable way of doing care, it'll be dominant and it'll be huge. But today, it's less than $10 billion TAM for us. All of medicine's $3 trillion. If we take 0.1%, we'll probably squeak by. It's really about whether these digital health companies get up on the beach and stay and colonize the land. And if they do, Zus will end up with a data graph of extreme value. And then established providers, they may still be on Epic or Athena or one of these traditional EMRs that are so great, or that are good for their time, better than their time, right? We all just want to be better than our time.
Yeah.
They'll still say, gee, I better check the Zus record before I operate on this guy. So that's the goal, is to get to a data graph, and then the TAM becomes large.
Right. I would imagine that, Andreessen Horowitz was your Series A, right?
Right. Yeah.
And so they're into big TAMs.
Yes.
Everyone's
The best TAMs are the ones that no one can see, right?
The TAM around the corner.
It's a TAM around the corner. That's exactly what it is.
Right,
digital health is small today, but it's got a lot of capital and it's got the brightest people I've ever seen. And if they take off, we will water ski behind them and have a very large TAM.
And so how are you guys approaching your potential customers? How do you try to get them on board? And what is that process like in meeting those people?
Well, I'm lucky to have sort of been paid to hang around the schoolyards of digital health for a long time. And so, to be truthful, I know most of the early customers of Zus, the former Athena Health employees or folks that Andreessen Horowitz or Maverick or these other F Prime have invested in. And even there, they're doing us a favor. We're building our minimum viable product with people who believe, who know the folks at Zus and believe that what we're going to do is going to be more than worth it for them. But in the beginning, we're begging our way through old friends and relatives to get those core anchor customers live and successful.
Hey, I want to shift gears a little bit and ask you about you a little bit, Jonathan.
Sure.
And some personal stuff, some professional history. You are from the Bush family, cousin of former President George W. Bush, nephew of the late George H.W. Bush. What was it like growing up in that big family, and how did that influence you?
Well, I don't know how, but I feel like I was very deeply influenced by my uncle, my dad's older brother, George, who I think both my dad and his mother are dead, so I can say was the favorite. He was just so extraordinary, and he wore it well. He went to war and he did well, and he went to Andover and he did well, and he went to Yale and he did well, and he married well and stuck with it, and had these jobs and did well in business, and then had these jobs in government that seemed very important, that were unpopular, and took them seriously, and gentled the conditions of dealing with China or having a CIA or being a Republican in the South. These were unpopular, fragile things, and he went and brought his gentle condition to them, and made them doable, made them sayable. And I find that to be a very important characteristic, to go into a place and gentle it, and cross lines, and try to civilize it. And I've always tried to. He was one of our first angel investor. In fact, I was told that the Barbara Bush Children's Hospital in Portland, Maine, was from a donation from the Bushes that was from their Athena Health proceeds, from their original angel investments in Athena. So he was a very important guy in my childhood. W was kind of on a different axis of the solar system. I didn't get to see him that much growing up. We saw him maybe in the summer here and there for a day, and certainly enjoyed every minute I've ever spent with him. But my uncle was really a really important character in my early childhood, and really stuck with it with me, and made time to write me back my whole life. And that made me feel like I had to do something. Like, George Bush is paying attention. I better do something useful. And I certainly feel lucky in that regard.
Right. Yeah. It's interesting. You were closer to George H.W. Than to W, but just sort of by vagaries of
your dad's brother is something different than your, the kids.
Right. Got it. And so let me ask you about Athena. You ran it for 20 years. You lost it in this 2018 takeover with Elliott Management.
Yeah.
You talked about being fired. I've been fired. It's a painful experience.
Yeah.
Is there a moment you can remember when you realized you were going to lose the company, and how did you process it, Jonathan?
Well, the moment I realized I was going to lose the company is when I was actually fired in my library. And it's terrible because I felt just such relief. I felt like Elliott was trying to get the company for cheap. I thought they were trying to not sell it, but buy it, and not buy it for a good value, but for cheap. And I felt like I owed it to the shareholders, no matter what they wanted in the moment. I felt like I was a fiduciary. And however inarticulate, in a battle like this, where I just never had any experience. But I just felt like I can't bow out if I think it's a ripoff. It's my one job, right? Everything else is fluff if you're a CEO, and so I could, and when Jeff Immelt came with his Dunkin' Donuts, said, "Sit down, John," I was like, "Oh, thank God, I don't have to fight anymore. It's not my fault anymore. I'm out." And I had always sort of theoretically known that I had money, because of the stock, but I didn't notice it. I had the same clothes I had when I was a consultant at Booz Allen or whatever, and so to be relieved of it, obviously, then I had to spend months hating myself and feeling betrayed, and waking up in the night wondering about mistakes I had made over the previous 22 years, and could I have done a better job? But getting fired is a really great, after you recover, assuming you do, a great experience. And to be able to rewrite your script with the wisdom of your previous play, really is better the second time you write it. So the answer to your question, short answer is, it was relief. And I'm glad to have had a fabulous beatdown, a Fight Club movie level beatdown, and to have lived, and been able to love and be hopeful again afterwards.
Yeah, it was high profile too. That's right.
Village Girl. He beats his wife. It was London Daily Mail. It was, woo! What an incredible beatdown. But looking back on, I'm like, wow, these guys are pros.
Right. And finally, last question, Jonathan. And I want to put you on the couch a little bit here. What are you looking to do? You're looking to grow Zus, but even more than that, what do you want out of life? How do you want people to talk about you and then ultimately remember you?
Yeah. Well, thank you for flattering that, get an ask like that from you. And you've covered a lot of people. What was it? Was it Lincoln? I give you 1,000 excellent reasons why I should be miserable right now, and I could give you 1,000 why I should be happy, and you just decide whether you're going to be happy or, it's the Ted Lasso challenge every day, all of us. And as a leader, as a guy running Athena, the thing that was most gratifying was watching people do more than they thought they could. As teams, as individuals, as part of a movement, the same benefits you get, when a religion is working for you or when patriotism is working for you. And at the time, religion was declining and patriotism was declining, but people were having that kind of transcendent, experience, and I was there for it. I don't know if I caused it or was lucky with timing or some combination, probably. But that was the most gratifying feeling I ever imagined. With my kids, same thing. When I see them, look up from the soccer field or from learning to walk and go, holy moly, So I just that's my drug of choice. I wasn't going to do a business of my own. I was helping other CEOs, which I really enjoyed. And I'm still doing that. But Zus allowed me to help hundreds or thousands of CEOs in the area where I would be an angel investor and board member at the same time. It has a policy implication. We should have a liquid common data model nationally. That would be more than any president has contributed to this country in a while. And it's, could work. And maybe I could uniquely at least attract the right people to do it. But my aspiration is to give out as many of those surprised looks of I'm part of something, I did something, am part of something bigger than I thought. And therefore I'll choose the happy fact set rather than the sad or angry or anxious fact set. That's it for me.
Makes a lot of sense. Jonathan Bush, CEO of Zus Health. Thanks so much for your time, Jonathan. Great to see you.
I'm flattered, and thanks a lot for having me.
You've been watching Influencers. I'm Andy Serwer. We'll see you next time.